I think anyone who's had foot pain knows why we worry about foot pain. But obviously, all of the weight of your body is transmitted through your foot with every step you take, and it's 3 times your body weight when you're walking and 5 times when you run. So if you think about that, it's a cumulative workload of 450 tons through your feet daily, which is about 165,000 tons a year. And most people walk about 70,000 miles in their lifetime. So your feet take a lot of wear and tear. So the problems the most common in the forefoot are bunions, hammer toes, corns, and something called Morton's neuroma, which is some nerve pain that you can have in your toes. Most people know what a bunion is. It was named after a turnip from the look that medial prominence gets there at the joint. And it's, we call it hallux valgus, that's the name that the doctors call it, but essentially that deformity through that joint subluxes the joint, almost dislocates it, and that's what creates the abnormal look. They can become very painful, however mostly it is in women. If you see it in men, it's almost always a genetic situation where everyone in their family has had a bunion, but women get them from high heels, and then they get that pain and swelling in the medial part of their foot. The first treatment is modified shoes. I know these are not attractive shoes, but wider shoes is the first line of treatment. A lot of times if you go get your foot measured, and you need to every 3 or 4 years for sure, your foot will change throughout your life. It'll get wider. Sometimes people's arch collapse and they need a wider shoe. So that's something to think about if you're having a lot of pain. If you or someone you know has a bunion and they go and someone says, oh, I'll do a surgery and you'll be better the next day and you can walk on it and it'll be no problem, be afraid, because if you see here, I've shown on the very left is what a bunion looks like radiographically. The middle one is where the joint has been realigned, the toe's been put back on top of the joint. If you look on the right, someone simply shaved off that piece of bone and they've taken all the articular cartilage off, so that joint no longer can function normally. So although they have less of a prominence, their foot is not going to do well for them. So beware, obviously. It's not, you want to go to someone that you think, oh, that sounds great, I'll have a minimally invasive bunion. But what you want is to have your joints balanced back, so just be aware of that. Hammer toes then, those are commonly affiliated with a bunion. That's when the toes claw up and they have that painful callus can develop on the joint on the top. Shoes are usually the problem, but if you get a bunion, it pushes those other shoes, that can be the problem too. And again, the treatment, we like to start with conservative, changing shoes. A surgery would just permanently straighten the toe, so you lose all the motion in your toe in exchange for a straight toe. A lot of times people think that's worth it if they're having a lot of pain and they have a callus or an ulcer develop over the top of their foot. Corns and calluses are very common, especially in people with diabetes. If you have diabetes and you develop these, it's important to go to the doctor and let us take care of them. We can trim them and control them for you so that they do not become a problem or get an ulcer or anything like that. They come from increased pressure mechanically from the bones underneath, and we can work to just make them more comfortable so they aren't hurting you inside your shoe anymore with softeners and kind of trimming those down. The last thing in the forefoot is a neuroma. If you ever hear someone say, my toes are just burning, this burning pain in 2 of my toes, well, the nerves that supply your toe go down between the toes and then they branch, and one supplies, say, your second and your third, the 2 different sides. So if you're getting numbness in 2 adjacent toes, it could be that nerve between the 2 is getting pinched and angry, and that's what a neuroma is. All right, midfoot. So a lot of talk or in the foot and ankle community is about adult acquired flat foot. So especially in women, but in a lot of people in middle age, your foot starts to lose its arch and flatten out, and that can be very painful, and that causes problems in the midfoot. So all of it is not a problem, but when it is painful is when it becomes a problem. So if you look at this person, their left foot, even though so the foot on the right that you're looking at is flatter than their other foot. They've lost their continuity of their midfoot and their foot has collapsed through the arch, and that causes a lot of pain. So obviously it's more of a problem if it's painful, if it's asymmetric. That's when we know it's not normal for that person. Early treatment is just an arch support to help support those ligaments that hold your arch up. If that doesn't work, then we like to see people. What I have here is a drawing of the normal arch, and then with a flat foot. There's a tendon that comes around the foot that inserts and it holds your arch up. Well, if that tendon tears, then you lose your arch, and it can be very painful progression like this person here has on their right foot. And so losing your arch and flattening, if it's painful, is something that you'll want to be seen for so that we can do things to try to prevent it from progressing to a complete rupture of that tendon and then complete flattening and arthritis, and it just progresses from there. So if you start to notice that you're flattening, it's time to go be seen and make sure that you don't need some sort of special brace or something put into your shoe to help support your tendon while it heals. All right, the back of the foot. Almost everyone has heel pain at some point in their life. It's very, very, very common. Plantar heel pain is the most common foot complaint that people come to the doctor for. It's called plantar fasciitis. I don't know if you all have heard that term, but it's commonly also referred to as heel spurs. There's no distinct patient profile, but people can be very miserable. And even with treatment, it can take up to 6 months to get it better. So the plantar fascia runs along the bottom of your foot and helps also to help support your arch. But there's, based on the different areas where you hurt, it could be something called that plantar fasciitis versus something called tarsal tunnel syndrome, which is compression of one of the nerves causing pain. Central heel syndrome is also called a stone bruise. When you have a deep bone bruise in the middle of your heel, that can sometimes be the cause. And then also if the plantar fasciitis goes on long enough, it can sometimes, your plantar fascia can actually rupture. Heel pain at where your Achilles tendon inserts is called, posterior heel pain. That can be very painful. Again, that's from your heel cord being tight and pulling on that bone every time you step. So again, first line of defense, stretching. Ankle sprains are another very common foot and ankle problem. I just read a study that said that 2 people out of every 1,000 will sprain their ankle every year. So that means that in a normal life, a good number of people will have at least 1 or 2 ankle sprains. If you have an ankle sprain or someone has an ankle sprain and they cannot put weight on it after a day, it's time to get an x-ray. All right, diabetes. I don't know how prevalent diabetes is in this group, but it is very, very common in the community now. And in the foot, diabetes is a big problem. As diabetes progresses, neuropathy affects the foot. You lose sensation in your foot. And a lot of times people can end up losing their foot because they get an ulcer that they don't recognize and they lose control of it, and then it progresses. Diabetics are living longer with their better treatment, and however, 25% of hospitalizations in people with diabetes are related to their feet and feet infections. So it's just something that every day have to check those feet. 10 billion American dollars went to care of the diabetic foot, and that was 6 years ago, so that's probably up. Amputations, 82,000 diabetes-related lower limb amputations per year. And the biggest part of the problems is that 50% who lose one limb will lose the other side within 3 years. The neuropathy is if you have foot pain at night when you're trying to go to sleep or when you lay down, your foot's okay during the day, but when you're trying to sleep at night, you get a burning pain in your feet. A lot of times that's neuropathy, which is the changes in the blood flow to the nerves from diabetes is affecting your sensation in your foot. That can be controlled with medication. However, it's something that you need to keep an eye on because it's the most common disabling chronic complication in diabetes. So take home points: good diabetic control, adequate healing requires good nutrition. You have to take care of your own feet, and prevention is the key. So foot pathology, it is a wide and varied field. There's a problem for everyone. But the majority of the problems don't need any sort of surgery, and they can be made better with just some smart changes to the shoe.